this video, we're going to cover the topic of NBCC policy on distance professional services. We will not cover the entire document in this presentation. I just want to look at some of the highlights of this policy and comparing it to some of the other codes of ethics that are out there when it deals with distance professional services. We have attached a full copy for you to look at after this training. So if you want to look at the full copy of that, you have the ability to do that. But I just want to make sure in this video we cover some of the major topics they cover in this video. So our main objective is for us to review and discuss the NBCC standards for distance professional services. And the first one we want to talk about is that NCC shall provide only those services for which they are qualified by education and experience. NCC shall also consider their qualifications to offer such service via distance means. I think it's interesting the way that this is worded here by NCC. As we go back and if you think about the ACA Code of Ethics, it talks about in Section H1 that if you are going to provide distance services, you need to have some type of training there. But it's kind of echoed here as well. It says you need to be qualified by education and also experience, and the NCCs need to consider their qualifications to offer via distance means. So right here, it doesn't give us a set standard of how much training that you do need to go through, but it is saying that you need to make sure you have that you do have education and experience in this area. And I think that's an extremely important detail for us to focus on. There are many individuals out there who want to practice telemental health counseling, and they may go watch a webinar, like a 1-hour webinar, whatever the case may be, and say, well, I've learned about it, or I've used a computer for a long time, so that should be enough. But if they're an ACA member and part of the ACA Code of Ethics, or if they're an NCC, Nationally Certified Counselor, it's saying here that you have to make sure that your education and your experience shows you're actually qualified to provide these services. And so I think it's really important to make sure that you are getting the right type of training for telemental health counseling. Once again, I do realize that not every state has a set number of hours that you need to have in training, and some states don't specifically show on their board website exactly how many hours of training you need. But the reality of it is, if I'm going to practice regardless of what my professional background is, I need to make sure that I have some type of training and education and experience in this area in order to be able to provide these types of services. Next, it says NCC shall carefully adhere to legal regulations before providing distance services. This review shall include legal regulations from the state in which the counselor is located, as well as those from the recipient's location. Given that NCCs may be offering distance services to individuals in different states at any one time, the NCC shall document relevant state regulations in the respective records. What I'm focusing on this part of the standard is that it wants you to look at the legal aspect of it from the state in which the counselor is located, and also from the state in which the recipient is located. So that's, once again, that's going to be an extremely important thing to do. So you may be, once again, licensed in several different states, but if you're only licensed in one state, it's still a concern for you to make sure that you're checking with the recipient's location to see what the laws are for that area. And if there's distance counseling laws in the books there, make sure you know what those things are. And not only do you need to check on it, it says you need to be able to document the relevant state regulations. So if I'm going to be having whether in my electronic health records or whatever the case may be, and I'm counseling somebody through telemental health counseling, then I'm going to make sure that I have documented in my records that I live in, let's say for instance, I live in Arkansas and this person lives in Mississippi and I'm providing services for them. I need to be able to document somewhere in my records that I did check the relevant laws, and I do know what the relevant laws are for the areas that I'm practicing in and for the state that the recipient is. And so making sure that is documented and put in your records is going to be a very important part of that. Next, NCC shall use encryption security for all digital technology communications of a therapeutic type. Information regarding security should be communicated to individuals who receive distance services. Despite the use of precautions, distance service recipients shall be informed of the potential hazards of distance communication. Not the least of these considerations is the warning about entering private information when using a public access or computer that is on a shared network. NCC shall caution recipients of distance service against auto-remember usernames and passwords. NCC shall also inform recipients of distance services to consider employers' policies related to use of work computers for personal communications. And so we have a lot packed in this standard here. First of all, it talks about NCCs make sure that they use encrypted security for all digital technology. And so that's going to be, once again, important for you to make sure you're being careful about the type of software that you're using that does that has some type of encryption security with it. And if you don't know the security settings on it or encryption settings on it and can't find information out, that's probably a very good idea for you not to use that way to connect with your client. It also says we need to inform the clients of the potential hazards. The fact that it is possible for somebody to break into their account and to get their information, whatever the case may be. And so once again, even though that's not always likely, the possibility is still there. And so letting people realize there is a potential for that happening if they're going to be communicating with you through telemental health counseling. Also, it says caution recipients of distance services against using auto-remember usernames and passwords. If anyone is like me, you probably have you hopefully have a different username and password for each website you get on. But for some people, they use the exact same username and password for everything, whether it's their bank account, video account, or whatever the case may be, they use the same username and passwords. And so some people have software where it would automatically log them into a website. The problem with this is if a client is connecting with you, maybe through a video service or whatever the case may be, and they're keeping a history of who they're talking to, things of that nature, so wait for the confidentiality to be broken there. And so once again, it's a good caution here for them to not use any of those any type of software that's going to auto remember their username and passwords. And so that's going to be important. And the last part of this is just making sure that if your clients are going to be contacting you from a workplace, that they need to be sure that their employer does not have an issue with that, or if they're going to be using a public access computer, like maybe a computer from a library, whatever the case may be, or something that's on a shared network, to realize there is some potential hazard of their information getting out because it's not their own personal computer. Also, NCC shall screen potential distance service recipients for appropriateness to receive services via distance methods. These considerations shall be documented in the records. One thing I'm seeing, we're going to see repeatedly as we look at these NCC standards here, is the fact that they want just about everything documented. And many other code of ethics, it brings up the fact that you need to be aware of certain issues about screening clients, things like that. But when it comes to the NCC, it's saying that make sure this is actually documented. And so it's going to be extremely important for you to make sure that if you have some type of process you go through to screen your clients, make sure you document that in your record somehow, how you went about screening them. Did you simply just say, hey, I offered telemental health counseling, do you want to do it? If that's all you did, you need to document that. But I think you probably need to have some type of process that you go through to make sure that person is appropriate for those type of services. And once again, put it in your records, and whether you're using electronic health records or paper records, make sure you document how you went through that process, and that way there won't be any questions if you ever get an audit on your records. Also, during the screening or intake process, NCC shall provide potential recipients with a detailed written description of the distance counseling process and service provision. This information shall be specific to the identified service delivery type and include considerations for that particular individual. These considerations shall include the appropriateness of distance counseling in relation to the specific goal, the format of service delivery, the associated need, the limitations of confidentiality, the possibility of technological failure, anticipated response time to electronic communication, and any additional consideration necessary to assist a potential recipient in reaching a determination about the appropriateness of this service delivery format for their needs. And so what they're looking at here is that they're talking about an informed consent. That's the basic of what this is looking at. Is that you want to have a detailed written description, once again, sent out and send it to your potential client So once again, they know exactly what they're getting into, and they're very specific about the type of things that needs to be in there. When it talks about the specific goals you plan on working on. That needs to be in writing somewhere. The format of the service delivery, if I'm doing phone, if I'm going to use email, if I'm going to be using video, that needs to be very specific. You need to be specific with that. Once again, the limitations of confidentiality. You want to make sure that is in there as well. If the possibility of technology failure, we know that's going to happen sometimes. You want to make sure what's going to happen if technology does fail. How are you going to take care of that? And also anticipate a response time to any electronic communication. And so NCCs, it seems in some ways they have some higher standards than some of the other codes, because once again, they want everything documented, but they don't want this as detailed written description for the client to be able to look at before they decide to walk into this. And I think this makes this a strong policy, because this has to be something that you have to think about beforehand. And so that way you're not just jumping on doing distance services. You're actually thinking about it beforehand. You have it written out. You know exactly what they should expect, and now they do as well, because you provided the information for them. Also, to prevent the loss of digital communications or records, NCCs who provide distance counseling services should maintain secure backup systems. If the backup system is also a digital mechanism, this too shall offer encryption level security. This information shall be provided to the recipient of professional services. So once again, how are you backing up the information that you're using? So if you're using an electronic health record, the client needs to be able to know that it's an electronic health record, and that has a secure backup on that electronic health record. And so once again, they want this to be documented, and this is something that's put as a part of the record, so they can know exactly how everything is being backed up. And this information shall be provided to the recipients of the professional services. So by these NCC services or NCC standards, we're seeing a great emphasis here on individuals making sure that the client knows what they're stepping into, and that once again, security, confidentiality, privacy, all those type of things is at the forefront of everything that we do, and the client is informed of what the risks are being involved. And so that's something, it's a theme we're seeing throughout these NCC standards. Also, because of the ease in which digital communications can inadvertently be sent to other individuals, NCC shall adopt behaviors to prevent the distribution of confidential information to unauthorized individuals. NCC shall discuss actions the recipient may take to reduce the possibility that they will send information to other individuals by mistake. I'm not sure about you, but there has been times before where I've sent an email to the wrong person and it embarrassed me. It could be on just about any topic whatsoever. Maybe I typed it in a little bit too quick, or maybe their email address is a little bit close to someone else's email address. I send that out. Or maybe it's a text message. I send a text message and it may go to the wrong person, and the content is not something I want that individual to see. And so we know that there are times where this has happened to us in our own personal life. Now, and from a professional standpoint, we need to make sure, at least what this standard is saying, we need to make sure on our end that we are being careful on who we're sending stuff to, and the same thing for our clients as well. And so practically what that would look like is, I'm going to double check the email address before I send the email out to make sure that is going to the right person. Before I make that phone call, I'm going to double check and make sure it's actually the right person's phone number that I'm calling before I make that phone call. If I'm sending out a text message, once again, I'm going to double check on that. And so I think the biggest part of it is making sure that on both ends, that it's important to make sure that each individual is double checking who is the recipient of the information they're sending the information to, just so that there won't be any mistakes, and that way information is not sent to individuals who don't need the information that's being sent out. Imagine sending out a treatment plan or emailing out a super bill that's going to the wrong person. Now you've got the person's private health information out there. You can be held liable for that as well. And so I think just taking your time when it comes to your record keeping, and making sure when you communicate, take that extra few seconds to make sure that the intended individual you want to send it to, that is taken care of, and just remind your clients of the same thing. In the event that the recipient of distance services is a minor or is unable to provide legal consent, the NCC shall obtain a legal guardian's consent prior to provision of distance services. Furthermore, NCC shall retain copies of documentation indicating the legal guardian's identity in the recipient's file. Now, this code or this standard right here, this is significantly different from any other codes that I have read before, because it's very specific when it comes to talking about dealing with minor clients or people who are not able to provide legal consent. And so here's where the issue now becomes. Depending on the state that you live in, individuals are considered a minor for mental health at different age levels. So if I live in Arkansas or Pennsylvania or Tennessee, wherever the case may be, I need to be able to know what the age of consent is for mental health counseling services. And so if that person is still considered a minor, and it says if you're a nationally certified counselor, then what you have to do is get the legal guardian's consent prior to offering any services. So you can't see the child client first and then ask for permission. They want you to go ahead and do that to get the permission first. And also, once again, retain copies of that documentation indicating the legal guardian's identity in the recipient's file. And so over and over again, we're going to see that for NCC standards, that it wants to make sure that we are documenting everything and putting it in the client's file. And so especially if you're using electronic health record, this should not be a difficult process for you, which most electronic health records will allow you to scan a document into that environment. That way you're able to keep it with the client's information. And so that's a good thing for us to consider. But it's I think that what we're seeing over and over again is that if we're going to do just about anything, they want documentation, and they want that documentation to stay with the client's record. And so that's going to be very important for us to practice. Also, NCC shall avoid the use of public social media sources, for example, tweets, blogs, etc., to provide confidential information. To facilitate the secure provision of information, NCC shall provide in writing the appropriate ways to contact them. Once again, they're wanting this to be in writing. They want the individuals to know what's going on. And it says avoid the use of public social media sources. The one thing I've seen in many cases is that once again, there's different social media groups out there where people are trying to find referrals for their clients. They're super specific sometimes about the information about the client, even though they're trying to do a referral. And sometimes I'll even throw in and say, well, I have the client's permission to post that. Well, that's great. It's great that you have their permission, but if you're given enough information that someone can identify who that client is, you still are breaking confidentiality, even if you have oral permission for them to find them another referral. So be very careful about what type of things you're putting on social media. Even if you're complaining or feeling upset about a client, social media is not the place to do it. Find you a supervision group. Find another therapist who you're friends with, whatever the case may be. Tell it to your dog, whatever the case may be. Find some way of getting those frustrations out, but you don't do that on social media, because that is not a good place for that to happen. All right, NCC shall provide recipients of distance services with specific written procedures regarding emergency situations. This information shall include emergency responders near the recipient's home location. Given the increased dangers intrinsic to providing certain distance professional services, NCC shall take reasonable steps to secure reasonable referrals for recipients when needed. In this video, we're talking about the standards from NCC, and one of the things I'm finding interesting here, once again, I think this is one of the more specific standards I've seen than many other codes. From many of the other codes, it talks about you as a professional knowing places to refer to the client in case of emergency. But according to NCC, it's wanting to make sure that you get that information to them. So if I have a client who I'm seeing an hour away, then I need to be doing some research to find out what's the community mental health agency in that area, what's the hospital in that area, what's the police in that area, whatever the case may be, and make sure that information gets out to the client. So that's going to be very important to make sure that the client is making sure that they have this information. And once again, this needs to be written down information, and we give that to the client so that they know how to get in contact with a mental health professional if an emergency occurs, because once again, with that being distance, there may not be a way for them to communicate with you immediately in the time of a crisis. And so making sure that they actually get a copy of this is going to be extremely important. Also, which is a very, very specific one, NCC shall develop written procedures for verifying the identity of the recipients at each instance of receiving distance services. Examples of verification means including the use of code words or phrases. Now, when it comes to codes of ethics, remember we always talk about whichever one is the most stringent is the one you want to go with. And this is definitely a lot more stringent than many other codes of ethics I've seen out there. It says that you need to verify have a written procedure for verifying the identity of the recipient. That's pretty standard across the board with the code of ethics. But it says that you need to do this at each instance of receiving distance services. That means at every session that I'm meeting with this person, I need to verify that this person is who they say they are. So even whether it's video, email, phone, whatever the case may be, each time I contact, each time I'm contacting them for distance services, I have to verify who they are by the passwords or the code word that they had come up with. And so I think right here, this kind of raises the bar quite a bit when it comes to different standards. We look at the ACA Code of Ethics. It just says you need to be able to verify. NCC says each instance. And so I think it's a good practice to be able to do that at each instance, because once again, that way, if you're documenting, hey, at the beginning of the session, went ahead and verified who the client was by picture or through the code word we set up during the first session. If you're doing that at every session at the beginning of it, the client may wonder, hey, why are you doing this? But I think at least that shows that you're using good practices to make sure you're connecting with them the best way possible. And so I think this is a good practice to do it at each session. NCC shall retain copies of all written communications with distance service recipients. Examples of written communications include email and text messages, instant messages, and histories of chat-based discussions, even if they are related to housekeeping issues such as change of contact information or scheduling appointments. Once again, the bar has been raised here. We need to document all written communications. If I'm just changing, even if it's something as small as the change of contact information, it has to be documented. If they're just canceling an appointment, moving it to the next week, it has to be documented. If you're emailing and text messaging them, instant messaging, once again, it said it has to be documented. And so once again, this raises the bar significantly for therapists who are using distance methods or telemental health to be able to connect with their clients, because they're wanting to make sure that everything is documented in the proper way and you have that in their client record. And so I think there is a bit more record keeping when we consider looking at distance telemental health counseling. But I think what the NCC is trying to help us to see is that we want to make sure we have got a great record to show everything we've done in the process of working with a client. If I am working with a client face to face, I think this will still be a good practice as well. But specifically, if I'm using distance services, then it's going to be important to make sure I'm documenting everything. And finally, it says, at a minimum, NCC should retain distance service records for a minimum of 5 years unless state laws require additional time. Due to the nature of most distance services, it may be convenient for NCCs to retain records for longer durations and thus may be considered useful for research or other professional activities. NCC shall limit the use of records to those permitted by law, professional standards, and as specified by the agreement with the respective recipients of distance services. So what it's saying here is that if your state law doesn't give you any guidelines on how long you need to keep records, it says you need to keep all your distance service records for a minimum of 5 years. And so once again, this is why I'm a big proponent of using electronic health records, because you don't have to worry about taking up space, and you're able to keep that information as long as you need to, because if you ever get audited or questions ever come up, you can kind of go back through and show exactly on each date when you did certain things. But once again, it says keep this for a minimum of 5 years. Well, I hope this video has helped give you a better overview of the NCC standards for distance professional services. Once again, this is not a complete look at this entire standards. This is just pieces of the standards that are a little bit different from some of the other code of ethics that are out there. Once again, please make sure that you look at the attached document that does have the complete standards for NCCs. That way you get a better picture of everything that's required of you. But this video just gives you a snapshot into what is expected of you if you're practicing distance counseling services and you're a nationally certified counselor.